As South Carolina begins to open, hospitals are seeing more people coming into the emergency room. Doctors say many of the injuries and conditions are a result of substance abuse. News 2's Danielle Hensley spoke with Lowcountry doctors who say this was expected and may continue to rise as more people start leaving their homes.
Doctors say some days half of the patients coming into the emergency room come in with drug overdose or drug-related injuries. Dr. Kenneth Perry, Assistant Medical Director for Trident's Emergency Department, says there has been an increase of drug-related cases coming into the ER since the beginning of COVID-19 related quarantine.
So that doesn't necessarily mean they're there for the substance itself. They might be there because the substance caused something else that they had, either an interaction or an altercation with someone. So we're certainly seeing substances and their downstream effects affecting the population.
Perry says it is typical for the ER to see a higher number of substance abuse cases during lockdowns, since people are at home for longer amounts of time.
We do see a lot of people who are using substances either as a way to cope with the depression of having lost their job or have to stay at home, at the same time as they're using it to cope with boredom and use that as a way to pass the time.
Jeffrey Kluver is the medical director for behavioral health at Trident Health and says the mental health community expected at the beginning of the coronavirus shutdowns that if it continued for very long, there would be a toll.
If we were to design a societal experiment on how to create anxiety and depression in people, we would isolate them. We would limit their ability to interact with other people, limit their ability to do things that are enjoyable and pleasurable, and the final straw would be to limit or eliminate their income.
Kluver says if you or someone you know is struggling with substance abuse, it is important to seek help as soon as possible. If you come in contact with someone who may have had an overdose, doctors say to check their breathing. Some drug use, like alcohol, can be healed with time, while stronger drug use will need to be treated by a doctor. In North Charleston, Danielle Hensley, Count on 2.